at orthopedic and sports surgeon at Khyber Teaching Hospital Peshawar and Khyber Medical College Peshawar. So today we are going to discuss with our trainees the rotator cuff of the shoulder joint. Okay, so to begin with, what makes rotator cuff? Okay, so there are the group of four muscles around the shoulder. This is the supraspinatus, infraspinatus. Then there come the subscapularis and teres minor. Then important question comes origin and insertion of these muscles. Insertion. Okay, so origin you can see that this is the scapula. We are utilizing the posterior surface of the scapula. This is the spinal process. It goes all around anteriorly and make the spine of the scapula. And it makes the acromion, and going further it makes joint with the clavicle. So we are looking from the back side, and this is another view from where we are looking at the front side of the scapula. And here comes the glenoid. So on the back side, this is called the supraspinous fossa. So supraspinatus takes its origin from the supraspinous fossa. Then it makes a tendinous portion which passes under the acromion and gets its attachment on the greater brachii of the humerus. This is the supraspinatus. Then comes the infraspinatus. It takes origin from the infraspinous fossa. So it has a broader attachment, bigger attachment. It also comes in along the inferior border of the spine of the scapula and gets its attachment on the greater brachii, but at a postero-inferior area of the attachment of the supraspinatus. Third one is the teres minor. It takes its origin from the border of the scapula. A small area is there. There are actually two muscles. One is the teres minor and the other teres major. So teres minor is the smaller muscle and also comes along the and makes the attachment just next to the attachment of the infraspinatus. So this is the supraspinatus. Then comes the infraspinatus, as the name indicates, from supra and infraspinous fossae of the scapula, and third one is the teres minor. While having a look on the anterior surface, there is a larger area from where the single muscle takes origin. It is called subscapularis, big tendon, and this broader muscle, single muscle, rises from the anterior surface of the scapula, and it makes attachment on the lesser brachii of the humerus. Okay, so if we just give a look to the shoulder joint, so this is the glenoid, and we are giving a look from the posterior side. So this is all greater brachii. On the tip there is the attachment of the supraspinatus. Then just postero-inferior there is a broader area where is the insertion of the infraspinatus. This is the infraspinatus, and still a smaller area just behind and inferior to this is the teres minor. So we have supraspinatus, infraspinatus, and teres minor. All of these are arising from the great tuberosity, begins with the tip of great tuberosity and then along the posterior surface of the great tuberosity. While the same, if we give a look from the front aspect, anterior aspect, so there is the glenoid, the humeral head, and this is the lesser tuberosity. So on the lesser tuberosity, there is attachment of the subscapularis. Sub subscapularis. Okay, coming to the function of these four group of muscles. So basically, as the position of these insertion reflects, subscapularis is basically is the strong internal rotator of the humeral head in the joint. So you can imagine that this is the scapula anterior surface, and this muscle runs and gets its insertion on the lesser tuberosity. So when it contracts, so it internally rotate the humeral head in the glenoid. So basically this is the internal rotator of the shoulder joint. Coming to the function of the supraspinatus, so supraspinatus, as the name indicates, it rises from supraspinal fossa and gets attachment on the superior aspect of the greater tuberosity of the humerus. So it basically assists in abduction and start the abduction of the shoulder joint. So the first 30-degree abduction is because of the integrity of the supraspinatus. Then is the infraspinatus. So as we already mentioned, infraspinatus is attaching on the posterior superior side of the great tuberosity. So basically when it contracts, so it basically it causes external rotation of the humeral head in the glenoid. So it's basically counterpart of the subscapularis. So the subscapularis and the infraspinatus are keeping in balance. When both are these are intact, so the shoulder joint remains in position. And the teeth minor function is very much negligible, but it's basically a sister of the infraspinatus. So same external rotation. So basically we can see that this is the attachment of supraspinatus. So we can see that this sling is all around except the anterior superior upper one third of the humeral head. So basically this is called rotator interval. This is basically interval mean is a space or a gap between the rotator group of muscles, and it has its important role when we are doing the shoulder arthroscopy. So we make always anterior functioning, I mean working portal through this rotator interval because it's safer one. There is no muscle around. Okay, so thank you. So this was the just brief description of the rotator cuff muscle.